This is a special Morning Mix segment.
I'm Todd Chance from the Morning Mix, and this segment is sponsored by Mercy Health. You know, as coronavirus numbers continue to rise, we are still seeing other people in need of medical attention, and recent reports have shown that cardiac patients, those with issues with their heart, have seen a decline in entering hospitals. We're with Dr. Hill right now, who can maybe explain this. Why do you think this is happening, Dr. Hill?
This really caught us all off guard as far as cardiologists, and this is something that's being seen not only in this country but across the world. People are seeing a 40 to 60% decrease in people presenting with heart attacks, but we did not expect a decrease in the emergency cardiac stuff. If anything, we expected maybe an increase with the stress of the coronavirus. We always see a bump in heart attacks during flu epidemics. You know, from a medical standpoint, I don't know if there's a good explanation for it, and that's our concern, is that people may be staying home with their symptoms of a heart attack and they're not seeking medical attention.
Yeah, that was my next question. I mean, if someone does have that fear, is that a valid fear?
You know, in this situation, I think you need to listen to your body, and you know, it's always hard to know what symptoms are maybe from the heart and what's indigestion. I guess I would still tell people to err on the side of concern and come in to be seen. And particularly if you're having chest pain that your concern could be your heart, I would still recommend people call 911 and come in, because if you are having a heart attack, your risk of something adverse or bad happening by staying at home is significantly higher than your risk of exposure.
What about folks who have just normal cardio care, routine care?
One of the things that this whole pandemic has caused is that we've really ramped up our virtual visits. And what I mean by a virtual visit is kind of what we're doing here, is either video visits or phone visits with your physician. Now, it's obviously not as good as being there in person and being able to do a formal physical exam and seeing somebody face to face. But I would say, you know, 80 to 90% of issues can be dealt with effectively with a virtual visit. And so I would really encourage patients to not ignore their chronic medical conditions and let them go and continue to contact their physicians and schedule these virtual visits, which seem to be working very well. And it's probably a temporary thing, and maybe your next visit is a face-to-face. But again, a lot of issues can be dealt with just in a virtual visit without getting out and exposing yourself to the coronavirus.
Thank you so much for that valuable information, Dr. Hill. And from all of us at Fox 17 to all you cardiologists and everyone else working in the hospitals taking care of the public during this pandemic, thank you so much.
Oh, you're very welcome. It's our pleasure. Everybody stay safe.